Can anything really be done about bags on my cheekbones and wrinkles under my eyes? I have bags right on my cheekbones. The right side is worse than the other, probably because I seem to sleep on that side. Also, they are outlined in red, and they get bigger if I am tired or had too much salt in my diet. I've been told they are Malar bags, and there really isn't anything that can take them away.
Thank you for your question. You submitted your question with several photos, and you're asking about the area of what you refer to as malar bags, or in particular on the right side of your face, on the cheekbone area, and the wrinkles under your eye. And you've been informed that this area is referred to as malar bags, and nothing can be done for them, so you're looking for additional guidance and opinion. Well, I can certainly share with you my approach for situations that are like yours. It doesn't necessarily apply to everyone who has that term malar bags applied to them, but with the photos you submitted, I can certainly share with you what I've done for patients like yourself. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years and helping people improve the eyelid and cheek area has been a very big part of my career. And so in the modern time, we've actually been very fortunate to have additional tools to help situations like yours. So to begin with, let's start with this area that it looks like a little bit of a pouch that's overlying the cheek area. Certainly there is validity to the nature of malar bags, which is essentially an area where there is fluid. And generally speaking, since it's fluid, it's not, patients will always ask me, can't you just stick a needle in it and pull it out? The answer is no. This area represents a certain area of fluid collection which is often associated with allergies, sinus issues, smoking, as well as just genetics. So of course, patients are always encouraged to manage their allergies, and if they're smoking, to stop smoking. Now that being said, we also have to appreciate more modern understanding of facial aging. And what that means is essentially we look at people's faces in terms of volume based on volume loss at several levels. In particular, bone structure. It is well known by various imaging studies that bone loss results in this deflation of the facial structure in terms of the soft tissue. The bones are the foundation, and the soft tissue drapes over the foundation. Yes, there's also loss of fat and soft tissue, muscle, etc. But one of the things that we've been able to do to help not eliminate the malar bag in a situation like yours, but to change what the eye sees when someone looks at you. And that method is called structural volumizing. Structural volumizing means placement of long-lasting fillers such as Juvederm Ultra Plus and Juvederm Voluma at the bone structure. And in this particular area of the cheekbone and the area of the malar, submalar zone of the face, if you could imagine restoring volume, then the accentuation of the malar bag over a deflated area becomes softened. And that also restores a lot of cheekbone definition. So it's not a direct removal, but rather a restoration of volume. This is a common issue, and it's certainly, I've found a lot of success in using this strategy for patients with similar issues. Now when it comes to wrinkling of the skin under your eyes, certainly there is a lot of options, and one of the options that I would probably consider is a laser procedure, such as fractional CO2 laser or fractional erbium laser. I would use something like platelet-rich plasma to help the skin quality and to improve the backbone of the skin. Certainly with the wrinkling concern, there are a lot of different options. But usually, in my hands, for a lighter skinned individual with similar situation, again, with the absence of physical exam and not looking at the tone of the eyelid, about the structure and integrity of the eyelid anatomy to avoid any problems from thermal energy being delivered to the skin, at least for wrinkles, it's fairly straightforward, and whatever other anatomic issues can also be addressed concurrently. But certainly when it comes to the malar bag concern, in this situation, I think structural volumizing can really make a potential impact for you. So learn about these options I've described and meet with qualified doctors who offer similar options and see if this is a good fit for you. So I hope that was helpful. I wish you the best of luck. Thank you for your question.